Care to chat? Hello and welcome to our podcast from the Northern Ireland Social Care Council. Social care and social work are such enormously important parts of life here. They really came to the fore during the pandemic. And now with the crisis in the health service, they're in the news again. So what are these jobs? Who are the people who work in them? What are the routes into social care and social work? How can staff progress and develop their careers, take care of themselves as well as their clients? And what reforms and changes are on the way? Well, one of those changes involves social work and schools. A number of schools here now have a social worker on their staff, or at the least as a regular part of the team. So let's find out more. Around the table with me are Colin Reid, who's Head of Safeguarding at the Education Authority, Maria Quinn, Principal of Abbey College, who has a social worker working in her school, and that would be Dylan Sloan, who's here as well, who's a social worker at Abbey College. He's a PhD student and his topic, conveniently, is social work in education. So really good to have all of you here with me today. It sounds like a brilliant idea, actually, Colin, a bit of a no-brainer in some ways. But tell us about the whole idea of social worker in education, the sort of who, what, why, when, how, briefly.
Okay, right. Well, school social work is a small but growing discipline of social work, particularly prevalent in other parts of the world other than necessarily the UK, America. Many other countries have employed school-based social workers. And really, I suppose what the concept is really that it's staff who work with schools, and schools are where children get their education and they have relationships with teachers. It's where they feel comfortable, and teachers play a really important part in children, their education, keeping them safe, helping them be educated, learn, develop. But we also need to support teachers in this very important task. And school social work is a discipline that works between education and the wider world, often bringing the skills of social work into schools to work with teaching colleagues in very difficult circumstances, but helping principals, teachers negotiate some of the complexities of the system, bring in their multidisciplinary skills, their networks, their professional abilities to try and help children. And we're seeing the growth across many parts of the UK of this discipline.
So, in a way, Maria, it sounds like having social worker in a school allows the teachers to teach and to do the things that they are trained for and that the children and parents perhaps expect of them. And then there's somebody else who's doing the other things that quite often we hear government ministers or politicians say, oh, well, we're expecting teachers to do that now. Is that the way it works for you?
Very, very much so, Wendy. And you'll understand that as a school leader, my core business is about optimising teaching and learning, high quality pastoral care, making sure that each individual young person has the opportunity to achieve their full potential. And one of the things that has become particularly widespread, I believe, in schools since COVID is that our young people are bringing and presenting much more complex needs in school. Wide-ranging mental health and well-being issues to do with child protection and safeguarding, self-harm, issues about even attendance at school when through lockdowns young people were at home for such a long time and they've really struggled to come back into school. And for me, we were the second school in Northern Ireland to bring in a school social worker, and I firmly believe now that we won't be able to do without that role as we go into the future, because Dylan, in his social work role, brings a wide range of skills and expertise, just as you've said, that teachers actually don't have. And he has enabled us, and he himself is able to navigate a whole range of multi-agency, multidisciplinary support and access to services very effectively. And he's absolutely invaluable in, as you've just said, supporting teachers in order to be able to do what they do best, with him bringing all of his portfolio of skills and knowledge to the fore as well. So it's very much a multidisciplinary approach, with the skills of the teacher working hand in hand with the skills of the social worker in order to optimise the learning and the development of each individual child.
I mean, it sounds like a fantastic idea, I must say. I mean, Dylan, you were nodding furiously while Maria was speaking there. Give us a bit of an example, if you could, of the kind of situations that you have been able to deal with at Abbey College. Just a kind of brief snapshot.
So just on the back of what both Colin and Maria said, their collaboration is really key, and I just want to acknowledge that. School social work is really about bridging the home, school and community environments. And within my role as a school social worker practicing in Abbey Community College, I've had the privileged opportunity to work alongside fantastic young people in all walks of life, and that includes young people that are engaged in statutory services already, such as care experience young folk, alongside young people that unfortunately their needs aren't being met at present by statutory services. And it's about the early intervention and prevention model, as well as, post-intervention. And I've had the opportunity, as I said, to work alongside some fantastic young people. But just to give you a flavour of some of the very current topics at the minute that I would interface in my role, it's the cost of living crisis. In Northern Ireland, it's no secret that our young people are facing budget cuts at financial times are very, very difficult for parents, and it's about navigating both statutory and voluntary sectors to really utilise what is out there and to try and bring those services to the young people within the environment that they attend every day, that consistency approach, and again, just working alongside those young people and families to ensure that their well-being needs are being met, because if their well-being needs aren't being met, how are they supposed to thrive in an educational setting?
How does it work? I mean, I remember years ago interviewing, I think it was Sister Genevieve from St. Louise's, who was talking about the way that they had a member of staff under whose door pupils who were in need slid a note, and magically then something happened to help their situation. I'm guessing that's not exactly how it works with you. So how does it work in your situation?
It's a multifaceted approach. Because I suppose it's about raising the profile of what social work is, and school social work has a unique opportunity of being a shop front. As I said, that consistency approach, which is so key for children to thrive. I'm in the school, I'm walking alongside the children in the corridors, I'm hearing what they have to say, I'm meeting their needs, and they're bringing now things to my attention.
So they'll come and talk to you, and they trust you to that extent now?
Yeah, very, very much so. You're now getting, alongside the teaching staff referrals, the senior leadership team referrals, pupil referrals, so children that are looking out for other children, and they know that there's a safe person in the school that they can go to and approach, and they will get support and help. Whereas at times, if it has to be, for example, take a young person with a mental health issue, within a school setting, the typical routine for that is, the teacher will call the parent will then have to get in contact with the GP, and we know at the minute in Northern Ireland it's very, very difficult to get a GP appointment. I think everybody can agree on that. And then they get the GP appointment, the GP has the meeting or the appointment with the young person, then they have to make the onward referral to statutory services such as CAMHS. Having a social worker in the school, the children know if they come and present themselves and their needs, that those needs will be met without all of those parts in the middle. So it's really emphasising that Article 3 no delay principle within the children's order. It's able to meet those children's needs and cut out the middleman so that their needs are being met, and it's being met at a higher and faster pace so they can get the support they need to thrive.
That must make a massive difference in your school.
Absolutely, absolutely, Wendy. It's phenomenal the way in which the skills and the access to services that Dylan brings to the whole pastoral dimension within the school is, as he's mentioned, it enables earlier intervention. It means that we can try and access services and support for our young people and indeed their families, because we also, as Dylan alluded to, we have many families who are in need of support as well. But it's very much, as we've mentioned, a partnership approach between our pastoral members of staff who take a pastoral lead, our year heads, for instance, the class tutors, everybody working together in order to make sure that we can intervene as quickly as we possibly can, as effectively as we possibly can, and support that young person's their health and well-being. Because if they are well and they are in school, then they're able to learn, they're able to achieve, and that then opens doors for them into the future.
From an education authority point of view, Colin, this has got to be a really good thing, hasn't it? I mean, why in that case are there only, what, about 6 schools here at the moment that are in this situation?
Yeah, there are about 6 schools who've employed social workers, and some other models as well. There are some schools will have family support people. There are some schools who employed health-related professionals. I suppose the commonality, it's kind of a place-based initiative. I mean, we've been very interested in the development of school social work, and indeed we're going to try and support that growing network that's being developed out there. People like Dylan, so there's a support network for them. We, of course, have our education welfare service, which was primarily based on an attendance model, per school attendance, but we've transformed that service over the last number of years, and we're moving to a much more preventative model now. Education welfare models, there's many overlaps between some of the things Dylan does and education welfare staff. Indeed, Maria will have her own education welfare staff attached to school, but they have many more schools than Dylan based in one school. I suppose that's one of the things that I think we can learn. It's the relationships that exist. I mean, I suspect, Dylan, you sit in the staff room and all those things that happen, those conversations happen round coffees that are really, really important. There's the community development element of it, because you will bring in, community development, voluntary sector, third sector organisations. And just being part of a school on a full-time basis probably makes a big difference. So I think we have a lot to learn from this model as it develops, and how we as an authority ensure that we provide the best support to services like Abbey College and school social work.
And I think there's another dimension as well, Wendy, which we're finding is very useful and is very supportive of Dylan in his role. About, I think it's 4 years ago now, well, I was just rather cheeky, I suppose, and I reached out to the Northern Health Trust with regards to school nursing services. And I just asked a question of somebody I knew regarding I was interested about the way in which, at that point in time, education and health were almost living in 2 different silos. And I had suggested to a senior colleague at the Trust, surely it would make good sense if health and education were doing a little bit more collaboration and a little bit more talking to one another, because ultimately it's young people and children who are at the heart of some aspects of the service. So we were able to embark on a school nursing project in partnership with the Northern Trust, and that was the very first of its kind in Northern Ireland, whereby a professionally qualified school nurse is directly linked to us in Abbey Community College. She spends most of her working week in school, and that has developed and rolled out now to a number of other schools across Northern Ireland. But you'll understand that sense of collaboration, that sense of partnership is clearly linked in with Dylan in his professional capacity. So we have our teachers and our pastoral staff working in partnership with Dylan, bringing all his portfolio of skills, and also the other side of the triangle is our school nurse, and she's bringing all of her school nursing expertise to the mix, so that we're really trying to strive for a holistic approach to looking after our children and young people in terms of all aspects of their health and well-being, so that they can ultimately do their best in school.
It's very changed times, isn't it, Colin? And big changes in education. Obviously, the kind of changes that Maria's managed to bring about in her school. But this is all happening while the money's being cut, and over the recent months we've been hearing so much about the budgetary restraints and so on. Will services like this be able to survive those budgetary restraints? I mean, that must be a big worry for principals like Maria and for others who perhaps might be hoping that they could be as lucky as she is at Abbey College.
Well, schools have been very imaginative, the ones that have employed social workers, in terms of how they've funded that, and there's some interesting funding models out there. I suppose everyone is very concerned about our current funding crises. We've got to make sure that our most vulnerable children are protected. I suppose there are opportunities in this through the adversity that we're all experiencing, and that we can be imaginative, creative, and maybe use this as an opportunity to do things smarter, better, in a different sort of way. I think what is key is we've got to work with our frontline colleagues. I must say I've learned that greatly in my time at the Education Authority. We've got fantastic principals, head teachers, senior leadership teams working as part of area learning communities, trying to do their very best. And I think when we all bring something to the table and work on partnership collectively, using our relationships, we can do what is best for children. So there are maybe some opportunities to come out in terms of the learning from the models that schools have evolved around school social work, particularly as we transform our own education welfare service.
I mean, I suppose sometimes it's difficult to persuade those who hold the purse strings, Dylan, but prevention is not only better than cure, but it's often cheaper as well. And, you've been studying all of this for your PhD, so you're the man with the knowledge, I'm very glad to say. I mean, how would you persuade them that this is the right road to go down?
Well, we have frameworks now that are being established, such as the emotional framework, children's emotional needs in Northern Ireland, and the Children Young People's the 2020 to 2030 policies. And within it, our Northern Ireland Executive have promised to support the well-being and increase life chances and life opportunities for our young people. However, as you've rightly alluded to, it's very difficult in terms of the financial situation at the minute. And I just want to bring into reality, the Northern Ireland Consumer Council Expenditure Income Tracker reported in September 2022 that the lowest earning households in Northern Ireland are earning an average income of £12,200, and they've been left with £29 per week after paying bills. And as you rightly have said, it's very difficult because we are in a situation where budgets are being cut. For example, the likes of the extended school budget is currently, being cut at the minute, and that's going to have a direct impact on the most vulnerable children in our society. Those children that are coming from those households with £29 per week left. That budget allowed for schools to provide breakfast clubs. So those children are now going to come to school hungry. When we also look at destitution households, the National Institute of Economic and Social Research has reported that there's 25,000 homes in Northern Ireland that are facing destitution at the moment. So as the cost of living should definitely be on the agenda, and we need a functioning Northern Ireland Executive to be discussing these things and to be fighting for our young people and our children in Northern Ireland, and providing the school social work model. It's alluding and it's actually meeting the needs of children. It's, when we look at the executive documentation, it's actually following the principles within it. So it makes sense, as you've said at the start of this, it makes logical sense for this model to be rolled right across the region.
Maria, you wanted to come in?
I just wanted to comment, I guess, that the partnership with the voluntary sector is also absolutely crucial, and we're very privileged at the moment to be able to provide breakfast and a free school meal for all of our young people at this minute in time. We've been doing it since January, and that's thanks to funding that's been made available to us through the Belfast Charitable Society, in partnership with the James Cain Foundation, and most recently Ulster Garden Villages. And those relatively small amounts of money are enabling us to make an impact on our young people and their families as people continue to face the financial crisis at the minute. And, we're very clear that if young people can have access to something to eat in the morning, they're likely to have brains that function better and therefore be able to learn better. And I think many of our families have found that the removing the pressure of having to perhaps pay for breakfast, perhaps pay for a school lunch or something to eat over the course of the day is helping them navigate through those very difficult times that we've all alluded to already in the conversation.
Just to go back to the history for a moment, if I could. I read a bit of your thesis, Dylan, which was very impressive.
Thank you.
And the part about the United States where they've had social workers in schools since the 19th century. I mean, I know that we tend to be a bit behind the curve sometimes, but this is kind of silly territory. They've done this all along, haven't they? It's been kind of inbuilt into their education system. Has the way that you've studied it, to what degree has that made a real difference, do we know?
So there's been numerous studies into school social work in the United States, as that seems to be the leading country. At the minute, the School Social Work Association of America recommend one school social worker to 250 pupils. So they really value this model. And studies are showing that attendance rates for children are increasing. We have studies in America that illustrate that children are completing schools, their whole school journey, whereas before they might not have been. So it's really valuable there, alongside the preventative and safeguarding elements. America is very much focused their model on that dual approach of prevention and safeguarding, whereas the very much recent studies in England are very much looking at child protection and that type of thing. But apart from America, school social work is growing internationally. It's now recognised in 48 different countries, and the last study published by Kelly in 2008 had stated that there's around 50,000 school social workers employed internationally, and it seems to be growing more and more, which is fantastic to see. But there's evidence out there to show a clear impact of implementing social workers in school, both for children and also for teaching staff, that collaborative framework.
Well, that's very interesting. I mean, one of the bits that I thought was interesting, and I know you want to come in there, Maria, but was the fact that there's a visiting teacher part in the United States as well. So that's a part of the way that the whole social work thing works. The social worker and the visiting teacher go and visit the child at home so that they then see the home circumstances of that child and can put perhaps their behaviour or whatever into a kind of context, which I thought must be an enormously valuable tool, actually, for a teacher to have. Colin, desperate to come in here, and I'll come back to you in a second.
Only to say you've just highlighted the importance of relationships and the relationship between Dylan and Maria, between teaching staff, and that partnership is what actually makes the difference. I mean, I met Maria some time ago, but and once you meet someone and form a relationship, she'll phone me now, or she'll send me an email, or if I need someone, I'll speak, and that works so much better. So the power of relationship, working together to help put our shoulders to the wheel to help children and families, is enormous. And what Dylan has described is something that works really, really well in primary prevention and early intervention. And I'm really glad to see the teachers going out in America with social workers to do home visits. I think that's very, very helpful.
Maria, you want
I think it's quite prevalent also, the social work in other European countries. I was part of an international study visit to Finland and Estonia back in November, and we found on our visits there that there was a social worker in most of the schools, or if not, perhaps in one school, certainly shared between a couple of schools in a close local area. Equally, doctor services, school nurse services, educational psychology services, all centred around the school environment, so that it was about, as Colin has alluded, those very important professional relationships, but that whole sense of services clustered around where young people spend a lot of time. And it meant that there was ease of access, effective communication, and once, as we've mentioned many times already, early intervention so that young people got the support that they needed.
And what about, Maria, that whole interaction between statutory services and schools, health and social care, obviously supportive of the interface between health and education, and you've talked about your school nurse as well. I mean, all fantastic ideas and interventions. You've seemed to have had a positive experience, but I got a bit of a smile there. Nothing. Things are very rarely as completely smooth. Sure, they're not. So, but it's overall, has it worked well for you?
Overall, yes. It has been a positive experience, and I think it's needed a different approach, I suppose. I've kind of taken the thinking outside the box kind of approach, and fundamental to all of this work, and the word has come up time and time again in our conversation, is the power of relationships. And it's that relationship, the building of those communication networks. It's, I suppose, taking the time to knock on a door and not being afraid to ask, can you help? Can we do something together? It doesn't always have to be done this way. There are other ways of turning things on their heads and being creative. So relationships and positive relationships are very much to the fore. But I think it's also the willingness to take a little bit of a risk. Because sometimes if you don't dip your toe into the water, then nothing changes and we continue to operate in those silos. Whereas if we start to talk to one another, we can learn from each other. I've learned loads from the work with Dylan and colleagues and equally into health. And I think it enables us all to do our own jobs that bit better together.
Yeah, that collaboration, those relationships and interaction, Colin, between statutory services and schools. I mean, when you're breaking new ground, it can be difficult sometimes, but it seems so that it's completely worth it. Well,
our colleagues in social services have very much the same types of issues that we have within education in terms of complexity. Complexity of cases, increased demand, and for them, fewer staff around to do more complicated cases. I mean, it's very challenging for colleagues in health and social care. But I think school social work can really help support the work that goes on within trusts. In terms of a partnership, we deal with maybe different parts of the Venn diagram, maybe early intervention and prevention. But if we can do our job, it will help support them in terms of cases that are referred on to social services. And indeed, when cases go to social services, the role that Dylan and colleagues can play to support families to deal with their problems and ensure children's involvement and integration and future learning in school is really important. It's really interesting. We have at the moment, most people listening will know about Ray Jones. Professor Ray Jones is carrying out a review into childcare on behalf of the Department of Health, and I know he's been very interested in the issue of school social work. I think he's been out to a number of schools and had sessions with young people in schools. So it'll be interesting to see what Ray says about that in his report. We also have other wider drivers such as Fair Start and reducing educational disadvantage, Department of Education. So people are very interested in anything imaginative, creative that makes a difference, supports families, enables children to learn, is good for schools. And I think we've a lot to learn from the various models that operate across Northern Ireland and how best we can integrate our services with the development of school social work where it takes place.
Just a final word from you, Dylan, if I could, looking to the future, since you're a part of it. It's exciting, I think, to see a focus on this. I mean, you're doing your PhD at the minute. Presumably you're hopeful that you might persuade, maybe not have to persuade, but encourage other young social workers like yourself to go into this field.
Yeah, I think that for me, as I said, I'm very lucky to be in the position I'm in, and developing school social work in Northern Ireland, studying my PhD in it, for me it's putting the social back in social work. There's something great about being able to go into a school and walk alongside the young people and having the time to do that. I understand, obviously, and reports are saying about the bureaucracy of social work. I have fantastic opportunities to walk alongside these young people, to support them in their highest achievements and hold them up in their lowest times. And for me, that's what school social work really is about. And that's what I'd like the future of Northern Ireland to bring to our young people and children here.
Well, we'll watch it with interest. Thanks all of you very much indeed for joining me today. Thanks to Colin, to Maria and Dylan. This is Care to Chat, a podcast from the Northern Ireland Social Care Council. Don't forget to subscribe and rate us. And of course, tell all your friends and colleagues.